to North of 60. My name is Heidi Schweighofer. Today, my guest is Patricia Stofiel. She owns an independent audiology clinic in Twinsburg. The name of that clinic is Life Hearing and Balance, and it's been there since 2019. She's also spent 18 years serving us in the military in the Army National Guard and is currently serving today. Thank you, Patricia, for being here.
Thank you for having me. I appreciate that.
All right, first, I'm getting older, our seniors are getting older, our audience is getting older. Are we always going to have hearing loss? And is that hearing loss going to get worse the older we are? Let's start there with the good news.
Well, it's wise to know that we are all getting older, and our hearing loss, it also changes as we get older, but everything's on a case-by-case basis. Sometimes I find that our older seniors that we have out there, sometimes they have better hearing than I do. And others, it just depends on different noise exposures that they have throughout the years. If they go to a lot of concerts, if they didn't wear their hearing protection. So then we get into what are the different causes of hearing loss. Sometimes it can be age related, which is called presbycusis. It's the natural aging of our hearing. Then we can go into noise-induced hearing loss. So how many times have you been exposed to an excessive noise hazard
in your lifetime?
Throughout your lifetime.
So even when you were 20 and 30 and going to extraordinarily loud rock concerts, that can influence one's hearing at age 70.
Yes, it can, absolutely. So it's very easy to explain to my patients that when they come in, we go over to through the anatomy of the ear. But most importantly, you have inner hair cells, which are sensory cells. And what happens is that over every time that you have an excessive noise hazard or you're exposed to that noise and you're not protecting your hearing, those hair cells that are moving back and forth in the fluid to then stimulate the nerve to send the signal to the brain for processing. What happens is that every noise exposure damages those sensitive hearing cells. And over time, they don't recover all the way. So if anyone goes to a concert and we find out they have a temporary threshold shift, which is where all of a sudden you have muffled hearing, or maybe you have a ringing in your ears that won't go.
You mean at the concert or after?
After.
Yeah.
So if those hair cells are stunned, and what happens is over time they don't recover. They don't regain the natural position where they were at. So they become damaged and they start to deplete. It's one part of our body that doesn't regenerate. It doesn't repair itself. So once they're gone, they're gone. And so instead of them being normal and floating through the fluid, they're going and they're being damaged over time, recover a little bit, damaged over time, until all of a sudden we're perceiving a difficult time hearing, understanding speech, especially in background noise. That's where people usually seek help.
I should have you visit my husband, who's in complete denial that he has hearing loss and played in a band when he was in his 20s. And was around the loudest music and still likes to listen to very loud music. I read, now I'm maybe wrong, I read that there are these types of hearing loss. One is called sensorineural, one is called conductive, and one is called mixed. So is that correct, what I read, and can you explain those to me?
Yes, so there are three types of hearing loss that patients will typically have. Sensorineural is a permanent hearing loss, and that permanent hearing loss is when I was going back to those hair cells. So that's at the inner part of the ear. And so when those hair cells are not able to move to stimulate the brain the way that they're supposed to, they're permanently damaged. And there is no medical or there's no medicine or surgery that can correct this. It's a permanent damage. There are different devices that we can get into for different types of hearing aids, implants, bone-anchored implants, or just a typical hearing aid. There are different variations depending on which hearing loss that they might have and if they're a candidate for it. There are many other factors that go into if this is appropriate for the patient, and so that turns into more of a consultation for what would be successful versus what's not going to be successful, depending on the hearing loss. Going into conductive hearing loss, it's more of you look at the outer ear, which is the ear canal and the eardrum, and then you can go into the bones. You have 3 bones in your middle ear. So a conductive hearing loss is when the outer ear or the middle ear, there's something wrong and the sound cannot actually go through the appropriate anatomy to get to the inner ear, causing an interference of signal.
Like what?
So for example, if there is trauma to the head, maybe you have a disconnect of those bones. How sound travels is it goes down through the eardrum, through the ear canal. It vibrates the eardrum, then vibrates the bones in a middle ear, which is an air-filled space, then vibrating the fluid of that inner ear where those sensory cells are. But if the eardrum is, for example, perforated, it cannot amplify the sounds naturally. If the bones cannot vibrate the way that they're supposed to, it cannot send the signal through, uses hinge points of a natural amplifier, again, to that inner ear to make it easier for the brain to understand. So if there's any issues with the eardrum or with those bones, that will actually give you a conductive hearing loss.
Okay.
Where the sensory cells, if we vibrate the bone, it goes right to that inner ear, right to the hair cells. And if they're moving the way that they're supposed to, then your hearing is not affected permanently. So then we would usually refer you to an ENT for further consultation. Do you need to have a medical surgery to restore your hearing? It's not necessarily going to become normal, but better than what it is. Sometimes we need to do a tympanoplasty, which is by restoring and making a fake eardrum so we can restore.
No kidding.
So there are different medical surgeries that an ENT can perform to help improve conductive hearing loss, or there's sometimes a tympanic steroid injection, depending on if it's due to an illness. I know you queeze when it comes to that, but when it comes to giving a certain medication, sometimes it doesn't have to be a steroid injection. Sometimes, depending again case by case and what the ENT prefers on how to treat, it could be maybe an oral steroid that you could take. And a lot of times that will restore if you have a viral infection to the auditory or the vestibular nerve, again causing a temporary hearing loss. So that will cover the first 2. When we get into mixed hearing loss is a little bit of permanent. So those inner hair cells are permanently damaged, and you have some sort of interference of sound. Either the eardrum is not working the way it's supposed to, or the bones in the ear are not working the way it's supposed to. You have a combination of the 2.
Okay.
So sometimes when you have an ENT referral, you'll have maybe the conductive restored, and then you're left with a sensory neural hearing loss.
So you still need a hearing aid of some type usually then?
Depending on case by case, yes. If it is severe enough to where you need a hearing aid, then I would seek an audiologist to help assist through that process.
My father-in-law had scarlet fever as a child and said that he lost his hearing in one ear due to that. Is that conductive hearing loss that would have happened with an extreme infection that happened back in the 20s when they probably didn't have medication that would have treated the infection as well?
I don't think that would be more of a conductive.
That would be more like a sensorineural one.
Yeah, sensorineural, because if you have, due to an illness, sometimes if you don't treat it appropriately, it becomes permanent because it's going to affect the nerves and it's going to affect how the ear is functioning. So, and we get a lot of that. We're seeing through COVID-19 shots, some people are starting to have increased tinnitus, or sometimes they find out that their hearing is muffled. And again, it's case by case. And research.
From the shots, from the vaccines?
From the vaccines, I'm starting to see that. But
temporary?
It's, again, case by case. Some of it's temporary and can be treated through hearing devices. It's just another hot topic that there's not a lot of research out there, but these are some of the trends that we're starting to find in the fields.
I don't mean to keep interrupting you, but is that in all ages COVID or mostly older patients who had COVID?
There is no set age.
Kidding.
So
I haven't heard that at all. Oh my gosh.
So it's just something to keep on the radar, but it is something that we're starting to see. So research is starting to develop. These are just some of the hot topics in research nowadays. There isn't anything set in stone or that it is going to cause tinnitus or it's not. I do recommend, in just my perspective, I believe in science, and so we want to protect those of who we love, and so want to make sure that we're all protecting, especially our senior populations as well, and that's a big majority of the people that I see. But back to, can illnesses become sensorineural? A lot of times it can be. Usually those viruses will affect the nerves, and when those viruses affect the hearing nerves, then we have what we call a sudden sensorineural hearing loss.
That's what he said happened to him.
Mm-hmm. And if you have that due to an illness, I would recommend you seek out an audiologist or an ENT within the first day or two, because there is a very short window. If you do not treat this sudden sensorineural hearing loss within a 48 to 72 hour period, there are chances of restoring your hearing become more rare and more slim to none.
No kidding. Mm-hmm. Well, and back then there would not have been, he wouldn't have known, his family wouldn't have known, but that is interesting. Do both of our ears have, if we have hearing loss, do both of our ears have the same? I'm guessing no, if we're talking about those little wavy things.
Mm-hmm. Those hair cells. So each of your ears are different. Think about it each one being a fingerprint. Your ear canals are shaped differently, therefore sound travels through your ears differently. The different frequencies hit your eardrums. Your eardrums are different. And therefore, 9 times out of 10, we see our hearing is very symmetrical in between one ear and another. They have to, for them to be symmetrical, the responses have to be within a certain decibel level of each other. If it becomes asymmetrical, I would refer you to an ENT per our FDA guidelines. Because of an asymmetry, we just want to verify that you don't have anything further causing that hearing loss that could be caught earlier than later. Acoustic neuromas, cholesteatomas. These are some tumors that are growing. I know.
Yeah.
I don't mean for it to be scary, but it is something that it's very important that you do seek out a medical professional, being an audiologist or an ENT, for this advice.
Sure.
We're trained to look beyond the hearing loss and just make sure that there isn't anything else beyond the inner ear or any other reason why your hearing is declining in a certain amount of time, and we want to make sure that you seek appropriate medical treatment.
Patricia, I want to make sure we have enough time to talk about hearing aids, but I want to ask you 2 questions. 1, can hearing loss be genetic? 2, does diet, exercise, medication, let's say diet and medication, can those affect hearing?
They can, they both can. So genetics, a lot of times I find, for example, I see the grandmother, the mother, and the daughter, and the sister. So it is
Really?
In their family, it is genetic. So it just depends on the different characteristics, and so it's important to know, did your mother, father, sister, brother, do you have hearing loss in your family? It's always good to know. And sometimes it's not genetic, and it, again, is case by case.
Diet and medication, anything with those?
So everything you put into your body, you can think about you putting it into your ears. You have a direct blood flow right into your ears. So however, if I like to look at, say for example, someone with diabetes, they're more prone to have hearing loss, especially if it's unrelated or untreated for a long period of time. People with cardiovascular issues, that also can affect their hearing as well. And some cardiovascular disorders can also be identified by maybe pulsatile tinnitus or some other factors that we can help So hearing is it's a center of many different things: social isolation, depression, looking at are you a high fall risk? So there are many different things that hearing is centered around. So being human, we want to communicate, we want to interact with each other. And so it's really important to make sure that we treat our hearing so we can still have those meaningful conversations. And so we can make sure that we're still socially engaged.
Oh, I couldn't agree with you more. I'm just thinking about my own parents in that situation. I told you before, as they became in their 90s and above, their hearing loss was significant and they refused to get it treated. And they became more and more inside their home because they couldn't hear when they went out. Even going to a restaurant was very difficult with background noise.
And that's a big complaint that I have all of my patients coming in. You hear someone talking, but you're not able to understand what they're saying.
Right.
They're in background noise, and then all of a sudden, the voices they can't understand in a complex environment. Just a quick synopsis: if you have a noise floor and then you have speech, and you don't have that separation between the brain and between speech sounds and noise sounds, it's difficult, and that's where speech becomes intermingled. So the technology...
With the background noise.
Correct.
Oh my heavens.
And the more severe your hearing loss is, the less of the gap that your brain has to interpret what's being said, because it's being drowned out by that noise. But the hearing aids, if you want to transition into hearing aids...
I want to especially transition to them because the big announcement was this month or last month that they're going to now be over the counter, which frankly freaked me out. So let's talk about hearing aids, and we'll go on to over the counter in a moment, but go ahead.
So hearing aids nowadays, the biggest concern and the largest demand that our consumers and my patients are finding is that they need more help in background noise. Before, they were big and bulky, and then they had a lot of feedback. Now, that's not a concern anymore.
Tiny.
They are tiny, they're nearly invisible. They're Bluetooth connected to your phone. You can answer phone calls hands-free. You can talk to someone, hang up those phone calls. They don't take batteries anymore. They're all rechargeable. Even the custom ones are rechargeable nowadays.
I had no idea. That is phenomenal. You can connect it to your phone.
You can.
How cool.
So you can stream all your media. Not only that, but a lot of the advanced technology will actually have fall alerts. So if you fall at a certain period of time, the hearing aids will detect that fall and automatically send a setup to your emergency contact, and it'll send up, John Doe has fallen. Or you can actually...
Patricia, I can't believe this. That is excellent.
So it's some great technology is out there. So when we look at that technology that's out there to help you with your everyday life, you have to really think about your lifestyle. How much, so the hearing aids that come in different levels of technology, so it's good for you to be cognizant of how much help you need in background noise and how much background noise is with you or around you on a daily basis. That's really going to help determine what level of technology that is appropriate for you. At Life Hearing and Balance, we like to take about an hour and a half for our first appointment to make sure that we really get to know you. I want to know what problems you're having, what level of technology I can recommend, but you're the one that makes that decision, not me. They're not my hearing aids.
In case you're a low-tech person.
Correct.
Or you live alone versus with other people, I would imagine then background noise changes a little bit in terms of one's needs.
Absolutely. So I would not recommend something that, I want to over-recommend what you don't need, but I definitely want to meet your expectations on a device that you do need. So given that private lifestyle, little technology, I would recommend more of a private to a quiet, a lower end technology. It will detect speech and detect noise. And so if you're ever in noise, it just gives you a little bit of an edge because it's not in your daily environment. But if you are very active, you're still working, you still have a lot of noise in your daily activities.
Or attending mahjong or bridge club,
Yes.
or going to senior events.
And you're in a big open room,
Yeah.
a lot of hard surfaces where sound can bounce off of
Yeah.
everything. You need more of a separation, and that's where the premium levels of technology will give you about a 10 decibel level, really detecting your noise floor, detecting the important speech sounds, and increasing it to make it easier automatically for your brain to understand. So it just depends on what's appropriate for you.
Well, one wouldn't get that level of expertise if one was to just go into CVS and pick one up over the counter.
No.
What exactly is what kind of hearing aids would be over the counter? And how would one even know what was appropriate for them?
So that's very difficult. Again, that would be case by case, and you really wouldn't know if you would be appropriate for you unless you would seek out an audiologist, get your hearing tested. What an OTC, which means over the counter, is an amplifier, and typically you would go and purchase it. It's only appropriate for people with normal to a mild hearing loss. It's an amplifier to really give you a bump in volume or maybe help you out in a difficult environment where you typically wouldn't need them on a daily basis, is what I read. I would be very cautious for those going out, and the big reason why is if you go and say, for example, you have a vision loss, and maybe you have glaucoma in your family, maybe you have another history or something
cataracts.
Starting. That's another one. You're seeking a professional that will test for glaucoma, that will be able to look at your eyes. Maybe you all of a sudden have your retina detached, or many other things that could happen. But without seeking that out and saying, if you go to CVS and just pull a pair of readers off of the rack and you put them on, you're like, okay, this looks good. Look at all of the different things that you could be missing out on that could be very harmful for you losing your vision.
Exactly.
And treating it sooner than later. So it's the same thing with hearing. We have those, as I've already mentioned, different ways that we can screen, and we can seek out are you in danger for having an acoustic neuroma? Do you have an asymmetry? Do you need to be referred to an ENT to get an MRI or a CT to make sure that you don't have a tumor growing? These are some different things that you're not going to get when you go to the store and you pull an OTC off the counter, and they can range anywhere. I've seen them advertised online for $80 for a big bulky thing that you put in your ear and you don't know how it's programmed, all the way up to maybe $800, $900 that you just connect to your phone. You take a hearing test on your phone, and then from there, the hearing aid, it programs itself, and you go about your business. So I know that I can support patients that do that if they have OTCs. If they want to come and see me, I typically have an hourly fee that I'll charge them because they didn't purchase it from me, and they're seeking device on something that I can't program.
And you can't really vet either.
No,
as far
I can't.
As, this is a good one, this is a bad one.
If it's appropriate for you, it's really difficult.
Why waste the money? I mean, even if it's the $80, I just can't imagine if I have hearing loss that I'm first going to go spend $800 or $80 or $200 to try to fix it myself. Mm-hmm. It's like trying to fix my own diabetes or my own broken arm.
It's nice to know that it's out there. So say, for example, OTCs would be a good transition for getting, for example, your father that didn't want to wear a hearing aid. And say, okay, we'll just try this as a transition piece.
Good example.
And so if he has a little bit of volume, but then over time he realizes that this is not really working anymore, then it's time, okay, Dad, let's go see an audiologist. They're able to get something else to give you that clarity that you need to really identify where you need that help at the different frequencies, how severe your hearing loss is at, to get you a custom fit hearing device. Because everyone's different, each ear is different. But we're able to make sure that we verify we're not over amplifying or under amplifying to really find your hearing loss prescription. And that does take a consultation and some time to find out what's really appropriate.
Just like with eyes or anything else. We have, believe it or not, only about 3 minutes left. I told you the time is going to go by very quickly. Can you talk very briefly about cost? And I don't want you to get into a lot of detail, but mostly I think that's been an inhibitor for some folks because I'm not sure Medicare pays for it. I know some Advantage plans do. I don't know if supplemental insurance does. Briefly discuss cost and insurance if you possibly can.
Sure. So I would definitely recommend that everyone calls their insurance company to find out what your hearing aid coverage and what your audiology services, what your plan does cover. I know that being in network is definitely going to be different than being out of network, but also your Advantage plans, some of them give a $2,000 benefit, some of them give a $3,000 benefit. The take home on this is for you to be educated on knowing what your coverage is, because I can't speak for every insurance or tell you how much that they would cost because every clinic is different. But if you know your benefits, just understand that usually your insurance will cover a low-end technology. And if you can only afford a low-end technology, that's going to be better than not having anything at all. You want to treat your hearing sooner than later. But if you know that it's going to cover that $3,000 benefit as a lower end, and you just have a discounted rate to increase, please make sure you focus on the lifestyle that you need and not on just what's covered, because I have patients that are expecting more and only getting less because they didn't want to invest in the medical equipment that's needed based on what their lifestyle pertains. So that would be the big take home.
All right. Patricia, thank you so much.
You are very welcome.
I think that what I notice when I go to and host senior events, whether they're big or small, is that there's a lot of folks that I would like to recommend see you, because they're either talking very, very loud, or they seem to miss out on what's going on around them because they just can't hear. They may be able to hear the speaker because we have a microphone, but they can't hear someone sitting right next to them who wants to have a little conversation. So I am very happy that you're here, and I want to tell you folks that Patricia's business card will be attached to the very end of this show. If you would like to reach out to her, you will have that information there. And wonderful news is that she will also be attending one of the Hudson Senior Network events this spring in the community room, and she has been gracious enough to offer private consultations. So about 10 minutes just to do a quick review of your hearing needs and look at your hearing loss if you have it. Information will be coming out, but watch for that. It will happen this spring. Thank you so much for watching North of 60, and thank you so much for being here.
Thank you for having me. I appreciate it, and thank you for watching.